And as you know, so many of our communities continue to struggle with the effects of COVID 19. And we have joined in this fight with like minded individuals as well as organizations to make sure that the word is spread about the importance of the awareness of COVID 19, the effects of COVID 19, the importance of vaccinations. We want to dispel any myths about COVID 19. And so tonight, our focus is on COVID 19 and our youth population, how it's affecting our younger children as well as our millennials, and why or why not they have decided to take the vaccine or not. And so tonight, we have a special guest with us. Dr. Nicole Donaldson is joining us tonight. And she is a medical doctor, and we're so glad to have her with us tonight. She is a native of Virginia. So Virginia is in the house to Dr. Donaldson, and she is a family physician and a medical director in primary urgent care. She has seen a COVID 19 firsthand on many occasions over this past couple of few years. And so she's going to share with us tonight her insight and her expertise around COVID 19 and our youth population. And so joining us tonight, we have a couple of young people, well, at least one of them anyway. Deborah Carlos is joining us, who is a doula in the area. She's going to be sharing with us tonight on our panel, as well as Miss Fran English, who is a retired nurse who served in this area for many years. And so today, join in with us in a discussion. If you have any questions that concerns you as we are talking and having a conversation about COVID 19 and our youth population, just put it in the chat. And we will certainly follow up with you at a later time in some of our future sessions. So tonight, as we get started, I think Deborah's going to start us off, and then we're going to join in with our conversation tonight.
The first question we will have for you tonight is, what are the long-term effects for children with COVID-19?
So some of the long-term effects, and it's challenging in children because younger children can't always verbalize what they're feeling. For younger children, so maybe adolescents, maybe from 12 on down, they may experience more fatigue. They can experience some chest pain, some shortness of breath, difficulty, keeping up with the other kids on the playground. That may be something that is noticed from children that are having challenges with long-term COVID. For the older kids, they may complain of things like brain fog or fatigue, being very tired. And this is something that comes on, kind of COVID comes, and then it's something that just kind of persists for weeks to months. I've seen that, we're focusing on the young adults, but this is a similar presentation as what's seen in adults, being the brain fog as well as the chronic fatigue.
So can children spread COVID without showing any symptoms?
Sure. So children have very, good immune systems, and sometimes there's this ability to not even be able to show any symptoms and to still be able to spread it. So children are frequently very affectionate. They, younger kids especially, and older children, they hug each other, they're hugging you. And so children who may not be manifesting any symptoms, it's very easy for them to then spread their germs based off of how close they may be to other people. The other challenges with children, and I know we'll get to this some later, is the mask. So not all kids can wear masks well. And so if you have a child and they have COVID and they don't have their mask on well, it is quite easy for them to then go on to spread that to other people, even if they're not showing symptoms.
Can children show signs of anxiety when they have COVID-19, and what would the signs be?
Certainly. One of the things I have seen with COVID is that there's a fear, the wearing of the mask, at least no longer because children are back in school, but the wearing of the mask, why can't I go to my friend's house? Why can't I play with my friends? My daughter has asked me that question very frequently. That is something that is new for some kids. For younger kids, they may not know any difference, but for the older ones, certainly, because it's something that breaks them out of their routine. The anxiety that they show may be related to them not being able to sleep well, them expressing a lot of worry, them constantly asking questions about what is going on. They're afraid of getting sick. They're afraid of taking off their mask. My daughter is 7, and one of the things that she's not really anxious about it, but one of the things I know is she's very particular about wearing her mask because she has expressed that she doesn't want to get sick and she's afraid. So in that instance, what we can do as parents and as adults in the community is just to encourage them that we have measures in place to try to minimize the spread, including mask wearing, social distancing, um, and just encourage them that we're going to continue to try to press forward anyway. So I tell my daughter that it's important for you to, you know, be aware of what's going on, but I don't want you to be afraid, and just give her measures of things that she can do. Good hand washing, hand sanitizer. She has little sanitizers in her backpack that if you're worried about somebody sneezing on you or coughing on you or having touched you and you're afraid of getting sick, you can always clean your hands up. You can always take a break away. I think it's important to also highlight this point that this is a good time to just acknowledge the fact that if we actually, we need to be engaging our kids anyway. We assume we know, but one of the things I try to do with my own daughter is just ask her, how do you feel? How do you feel about COVID? What worries you about it? Encourage conversation, because what we see is maybe bad behavior or restlessness or questions being asked, not wanting to go to sleep, is not necessarily a child being hard-headed or being disobedient. It is a child who is afraid and doesn't know how to express it, especially for younger children. Older children, you know, may manifest with more, you know, similar symptoms, but they're able to tell you better. And so, depending on the child that we're dealing with, the children that we're talking about, we do need to at least ask the question and make sure that we're watching for changes in behavior. And if you notice it and it's something that's concerning you, follow up with the child's doctor. Let them know what's going on to see what can be done. This is something that's going to be with us it's going to be with us, I think, for a while. I'm hoping it gets better, but I think no matter what, it's going to always be around. And so it's something these are conversations we need to have with our kids.
And Dr. Donaldson, do you think masks are effective for children?
Before we had vaccines, we were reliant on masks and social distancing. Masks work. However, and this is a big however, nothing works. The big areas we need to cover, really we need to have our eyes covered too, because virus can enter through the eyes. But having the nose and the mouth covered. We go out, we see people with the mask underneath their nose, and children, they're active, so they can pull the mask down because of, I can't breathe, I'm having trouble breathing. Making sure that the mask is proper fit, because they have little faces, but we give them an adult mask. You can't keep it on the face. But I do believe prior to vaccinations, masks were the only thing we had, and they're effective in adults and they're effective in kids, but only when you use them right.
So I know that they just ended the mask mandate. The kids don't have to wear masks in school anymore, and some are relieved, and some of them still have that anxiety. But because of COVID, do you think that has affected the children's education, or kind of just making friends, that peer interaction? How has that affected the kids?
Well, I have a lot of patients that are teachers in elementary school, middle school, high school, even teachers in college age. And what I will tell you is, as far as my daughter was in kindergarten during 2020. And so because of that, she did all her schoolwork virtually. Has it affected her in terms of social development and peer interaction? Definitely, because she's the only child. And so to not even have friends to learn how to manage things socially, it's a new experience for her. Educationally, thankfully, my daughter doesn't seem to have had any gaps. But what teachers are finding is that because there was such variability in home lives and in the way that the virtual learning was done, there's such big gaps. There's some kids that don't know things that they should at that particular point in their education. So it has hugely affected education. So teachers are having to spend a lot of time filling in holes and making sure that children are up to par with what they need going forward. So yes, it has affected education, and it definitely has affected peer interaction, because you can't even see your friends like you would like to. makes it harder for people to just learn basic social skills because you are at home away from all your friends. So I definitely believe it has had an effect. How do we work around that? One of the things I'll tell you, my daughter has this kind of standing play date. It's virtual. The little girl doesn't live here. But if she did live here, it probably would be the same because for a long time we were nervous about just having someone in the house because we don't know other people's activities. And so one of the things I've seen my daughter do is they play together and they're going back and forth, and it's kind of nice to watch them build their friendships by having a chance to talk to people at home, but also just interacting through FaceTime and other means of just having conversations. I think that is valuable in terms of helping them to develop the social skills. But it's certainly, if you are 7 and 8 years old and friends become super important and you don't get that, it's certainly going to affect you.
Absolutely.
For sure.
Yeah.
So, Dr. Donaldson, how has COVID-19 caused depression for children and young adults?
Because there has been so much death. I see a lot of adults. I have a small population of children in my practice. And what I will tell you is it has affected them, of course, because of activities. Can't go to birthday parties, hadn't been able to go to birthday parties, hadn't been able to do all the social things that children do when they're younger, that people do when they're younger. But in addition to that, having family members, grandma is not here anymore because grandma had COVID. And it may be grandma and auntie and parents, and watching all this death occur. That situation, being isolated, all of that can lead to depression in children. And so again, the same kind of piggybacking off of what goes on with anxiety, you got to have these conversations. Does your child seem sad? Are they playing with their toys? Are they crying a lot? Are they clingy? Every child has a pattern. So if you're looking at that child and you're noticing that instead of my daughter coming and sitting alongside next to me, she's in her room and she's laying down or she's teary all the time, got to ask some questions. I think the conversation needs to be had before you ever see those signs. Are you talking to your child? How do you feel? Grandma passed away. Does it make you sad? Are you scared? So COVID has caused depression in children, and it's affected not just the children, but it's affected young adults and on, because just seeing so much negativity and so many bad things happen as a result of a pandemic, on top of just the regular life stressors. But if you add that to the mix, yes, it has for sure done that.
Dr. Donaldson, do you know if COVID-19 has affected more African Americans children rather than Caucasian children?
Definitely, for sure. A large, and when I was asked to do this, I did a little reading to try to but try to better understand why that happens and the underlying aspects of it. So a lot of the times in African American homes, you have multiple generations that live there. In addition, you have people who work outside the home that could not stay home and work remotely. Essential workers, certain essential workers. If your family member works in a grocery store, if your family member works in the hospital, as a in the cafeteria or in the cleaning staff, you can't stay home. You can't work remotely doing those positions. So in my reading, it stated that our children are normally raised by someone who is an essential worker. I'm an essential worker. Healthcare workers, anybody. So we tend to have more African American people working in essential jobs, and as a result, you couldn't stop working. Not only that, there's not enough resources to get health care. There may be issues with transportation. That's not to say everybody, but when you compare resources between races, we tend to struggle more. African Americans tend to struggle more with social economic factors, and that plays a role in the care that we are able to get. But also, when we go to the doctor, we tend not to get the care that we are due because of racial bias. It is a subject that no one wants to talk about. It's a hard subject, but it's factual. So because of that kind of stacks up the odds of African American children being more sick. They are from what I read, 5 times more likely to be hospitalized, 5 times more likely to be more sick because of all those factors that I mentioned. So it does disproportionately affect African American children. And again, these are the conversations we need to be having so that we can make sure that when we're noticing things going on, we don't ignore what it is and we go seek care to the best that we're able to do.
So, Dr. Donaldson, what age group is more likely to face challenges when they are wearing the mask, actually?
I would say children under 5,
Mm-hmm.
because it's hot. I want to play. I can't breathe. And it's hard to reason with children as when they're younger. It's harder to reason than when you're talking about them pulling. I think it's a harder population because they may not understand why they have to do it. As with young adults, teenagers, this is stupid. I don't want to wear this. It's making me hot. The mask is on, but it's underneath their nose. That is a challenging population too, because at that point, adolescents are they have their own wills and things that they're willing to do, and so that's the battle there. But I think the biggest challenge is for the younger children because they may
Mm-hmm.
not understand. They may not understand why they have to wear it. Again, I use my daughter. She's my best example. Even when she was younger, she was 5 at the time, and I explained to her, this is why you have to do this, because if you don't, you might get sick, and if you're sick, you might make other people sick. Oh,
Mm-hmm.
and mommy and daddy wear it too. So it's not just you, it's us. So I think some of the way, we discuss problems, and yes, they exist, but in my head, what can we do to fix this stuff? And a lot of it is letting your child know the expectation and helping them. You don't have, I grew up in a generation where my parents didn't tell me why. The answer was because I said so. Well,
Mm-hmm. Right.
now my
That's right.
daughter, very logical. That's the way she's wired. So I tell her, you're doing this because you could get sick, and we don't want you to get sick because then you can make other people sick, including your grandparents they have medical conditions. We can't do this. And so now I would have to pay that little girl money to get her to take that mask off when we're out, because she has just been taught that this is why you do it, and she doesn't want to get sick. So I think if you get your child to understand, it can be overcome. But even at a young age, that's still
Mm-hmm.
challenging. So in that instance, you do your best. And if you know the child is struggling with it, you may just have to keep them away from people. That may be the alternative, especially if they're super young and you can't reason with them and get them to do it.
Gotcha. Makes sense. What about those children with underlying conditions like asthma, bronchitis, or respiratory issues? How has COVID-19 been affecting them?
Well, their risk is higher. They tend to get sicker. The children who end up in the ICUs and on the breathing machines and things along that line, there's a likelihood that they're going to have more serious conditions, as a more serious COVID infection as a result of them
Mm-hmm.
having these underlying issues. And so it's the same across the board. So for those patients, when it comes to the ability to vaccinate and wearing the mask and using any kind of precaution to keep themselves safe, it's a big push. Like, please do this, because I could get a cold and I could get COVID and my COVID would be gone in 7 days. You could get COVID and you could have it for the next 2 to 3 months with the
Mm-hmm.
flared up asthma and the coughing. And I've seen it where a child is sick and then they get better. They get a little better, but then they all of a sudden I've seen them get worse, and then they just keep coughing and coughing, and they're short of breath, and you got to add medications to try to get it to level out. And COVID has the potential to create long-term effects. So to answer the question, how does it affect children with underlying issues? It can worsen them. It can exacerbate the conditions that they already have because their lungs were already at a deficit when it all started. And COVID, as we're seeing, is not very nice. It's not a cold. It's more. It can be more severe than that, depending on genetics and on underlying conditions.
You're so right. So thank you for that information. I was thinking too, as we were talking to people a bit earlier about social media and how social media is playing into people becoming vaccinated or not. And then how has that kind of contributed to the number of cases that we've seen increase over time in our country?
So The fact that COVID can cause sterility, the fact that with the COVID vaccine, someone is putting a microchip in you that can track you. All of these not proven ideas have made people not go get vaccinated. I have a patient of mine who has asthma, and I asked her, "Why haven't you been vaccinated?" And the first thing that she said was, "Well, they said it can cause too many problems, and I don't want that." And so, yes, misinformation on social media has affected people going out and getting vaccinated, which has increased the rise of COVID. What I did do was look up on the CDC website as of February 23rd, the percentage of people who have been vaccinated based on age. And what I saw was that 57% of people 12 to 17, let me go back, 5 to 11 is 25%. And this is both vaccines, not necessarily boosted, but both vaccines, I'm sorry. 5 to 11 was 25%, 12 to 17 was 57%, 18 to 24 was 62%. So as the ages go up, there's more and more vaccination going on. Now the 5 to 11, they're fairly new on the scene with getting the vaccine, so that kind of makes sense because there's maybe a bit of a lag because of it being fairly new. But I'm saying all that to say that the people who are heavier into social media tend to be the younger folks, and the population getting vaccinated is half to a little bit less than 2/3 of that population.
Mm-hmm.
So I believe that a lot of misinformation out there is creating this issue where people do not want to get vaccinated. And I even had some of my patients tell me, "I don't think COVID is real." And when I mentioned that to my doctor colleagues, my one patient, my one friend who's a pulmonologist who has intubated countless people because of COVID said,
wow,
as they're being intubated, they'll say, "I still don't believe it. I still don't believe it's real." And so it sounds completely crazy, but what the information that you are reading and what you're receiving helps you guide your decision. Also, when I was reading, comparing millennials to baby boomers, millennials get their information from places like Twitter, Facebook, Instagram, a blog, whereas older patients will read books. They'll go and read the newspaper. They'll go to websites that are a little more now the CDC has done some questionable things, but they do track data and they track numbers and they track symptoms. And so that's normally what I'm kind of going by in terms of seeing what COVID is doing. I went to the NIH website and they actually have boiled down the information into lay terms so that you can understand what it means, but you have to get your information from good sources. The other question that I asked was, if you're worried about a vaccine, and I know I'm probably going over to the next question, but I want to state this. While you are worried about getting a vaccination and somebody tracking you, you have a cell phone, you probably have a watch,
right?
you probably have a tablet, and there's all kinds of chips. You have a car, maybe, if you're old enough, and you're being tracked everywhere. Yes, Alexa, Ring camera. Did you come into your house? You're being tracked. So in terms of misinformation, if we put it all into proper perspective, it's an illness. It kills people. It is not worth your life with something that you could get a vaccine for.
Absolutely.
Do you think that, because on Facebook and Twitter, when people post information regarding COVID-19, they always give like a disclaimer, they're saying this could be false information or this speaks about this topic and may not be true. Do you think those warnings help at all?
No, I don't. Because that is a way of saying, I put it out here. I don't know if it's true, but read it if you want to. And if you read it and it sounds like it might have a little logic and you have not made yourself well versed in what the facts are to the best of our knowledge. And that's our Achilles heel, is that the medical community is learning things as the lay community is learning things. So when this all first started, I said, I feel so powerless to help my patients because I know as much about this as they do. And so when they go on the CDC website, I read this, and I have to go and try to find other information to pull along with it. That makes it more challenging. So if somebody puts some information out there and it has a slight ring of truth, people are going to go for it, and then they're going to start trying to find reasons why it is true.
Facts.
And
Right.
so when people put information out there, in my mind, if I'm not 100% certain in what I'm saying, I'm not going to put it out there. I'm just not, because I don't know. And I don't want to have you, and this is just not some policy because I'm a doctor, but just in general, I'm not going to mislead people for the sake of a lot of replies, for the sake of seeing what happens, some kind of experiment, which, on social media, people will bait you with a lot of the statements that they make, and they just want to see what's going to happen.
Right.
And so that's why I say be very careful where you're getting your information from. And I'm commenting on being a layperson because you don't understand that medical stuff. When I see my patients, I don't say you have hypertension. Your blood pressure is high because you ate too much salt. So we have to get away from the medical jargon and try to boil it down. But you need good, solid information to make decisions on. And based off what I've seen with the amount of death, almost 1 million people dead. I have a lot of my colleagues, my friends from medical school, seeing people come in just not doing well. One of my patients, now granted he was very old, but he was very healthy. He died because he had COVID. His wife, who has COPD, didn't die, and they're the same age. So you don't know how it's going to affect you. This is not something to play with. And I say this with all sincerity. I just wish if people didn't have the facts that they just wouldn't say anything, because it confuses things. Absolutely. And it makes it hard for people to make good choices. I didn't mean to go off on a rant, but that's like my soapbox, because I really wish people could get the actual information that is needed to make smart choices. And it's hard when there's so much information coming at you all at once.
Definitely.
Dr. Donaldson, what do you think the attitude of the millennium is as it relates to the COVID-19 vaccination? I have people in my family who won't take the vaccine.
I believe. Right. So what I have had people say is, oh, it was too quick. How they come up with a vaccine that fast? And they put something in it. I had one patient tell me that he believed that Black people were given one vaccine and white people were given another vaccine out of a different vial. And it was a ploy. It was an experiment on us to try to kill us off. And so so you're asking specifically about millennials. I think when you're young, I don't want to assume things, but I'm just going off of my own experience. You think the things will never affect you. So I don't need to get a vaccine. I'm fine. I don't want to take it because it's going to make me sick. I don't want to take it because so-and-so took the vaccine and they developed, their legs started hurting 3 days later, or whatever that side effect that they believe may have been. And so you hear all kinds of ideas, and I believe there's a significant mistrust. There's a mistrust of the government. There's a mistrust of healthcare. Everything's done for money. I don't want to be tracked, like we were mentioning before. And so the attitude is, when I go back and look at the numbers, it's roughly between 50 to 60% of folks that are actually going out and getting vaccinated. And I think there's a hesitation because there's a mistrust. Now, what I did ask my one patient, and maybe I was being a little sassy when I asked her, I said, "What'd you eat last night?" She said, "Oh, I had McDonald's." I said, "You trust that? That is not something that I don't think I'd be eating. You're worried about a vaccination." And let me just say this. We have been studying coronaviruses as such, as a class of viruses, for years. And so when COVID comes out, it's not out of the norm to know how it looks, behaves. Right. So to come up with a vaccine quickly doesn't shock me. At all. We have cell phones. I could call somebody in Japan right now and have a whole conversation like they were right next door to me. And so technology has advanced us so quick that we don't have to take years to come up with ideas. And so what I tell them is, if you're worried about the speed of a vaccination, you use your cell phone every day. You're willing to trust things you can't see. You breathe the air. You're eating all kinds of food. You will drink all kinds of drinks and energy drinks and whatever else, and you don't know what's in that. But this is potentially going to save your life, keep you from getting super sick. So the attitude is one of mistrust, which is very sad. Healthcare has lost a lot of credibility due to past experience. But I will tell you, just as a person of color who practices medicine, this is one of the top reasons why I did it. It's because I wanted to be able to come in and give the truth and be trusted and honestly care about what happens to patients. And so that attitude, I understand it. It's one where most people don't want to deal with it because they're afraid of what might happen to them if they take it. However, we know that patients who have been vaccinated, they do better even if they get COVID, which is possible to still get COVID, even if you've been, even if you've been vaccinated, but you just don't get as sick. Instead of being on a ventilator, you may be home for a couple of days not feeling well, but you'll come out of it faster than if you were never vaccinated at all. One of my patients is a respiratory therapist, and she was telling me a story. And when she told me this, the hair on the back of my neck stood up. She said, I had two young ladies. One was 20, one was 21. They were not vaccinated. They called us into the room because they were getting ready to get be placed on a ventilator, and they ended up dying before they could even do it. 20 and 21. These are young people with no health issues. So this is not something to play with. And so the answer, my very long answer to the question is the attitude is negative. And while I understand it, you got to do what makes sense. Vaccines have worked for years. When you were a child and got all those vaccines, you got flu shots, you've gotten all these different vaccines. Some things I can tell you I've never seen in person. I have diagnosed one case of chickenpox, and the only reason why I knew what it was because I saw it in a book once. Because some things we don't have to deal with anymore because of vaccines. They work. That's why certain things we'll never know. Polio, we don't know about. Smallpox, I've never seen. It doesn't even exist because of vaccines.
Also, with the patients that you are seeing, how does COVID-19 affect their mental health? And I do have another part to that. And what about, and compare it to like the younger populations?
So with the younger populations, I feel like the younger folks kind of are a bit more resilient. Things may happen to them, and as long as they have a good home life, a good support, they tend to do okay, and it doesn't tend to linger as much. Overall, has as a primary care doctor, as a family physician, I didn't know this when I was training, but I also am a psychiatrist and a therapist. And I'm not saying that in a flippant way. I'm saying it in a very real way because patients will come in and I ask them about their stressors because it affects health overall. And so in terms of mental health, depression is worse, anxiety is worse, stress is worse, which makes everything else more difficult to manage. Younger children children tend to be way more resilient than adults because there's less past things to overcome. There tends to be, they kind of are in a mental bubble so that they don't realize everything in their environment is affecting them like we do as we get older. We realize that we're only a small part of a bigger world, a bigger scenario. And so I think kids tend to do a little better, but I think in terms of their mental health, a lot of that is contingent upon parents and structure. If the parents are there to support them, to monitor them, to make sure they're okay, to talk to them, I think they do okay. But like anyone else, a child left with a lot of questions and fears that don't get addressed do go on to depression and anxiety, maybe attention issues, focus problems as a result of having had either having had COVID or just been a part of this pandemic. This world, as we're seeing outside of COVID, looking at Russia and Ukraine, not to veer off topic, but the world has gone crazy. And so everybody is stressed out. So the pandemic has had a major effect because people are scared. And when they come to the doctor, they're looking for someone. What I get a lot of is just reassurance. Am I going to be okay? Is my breathing okay? How do my lungs sound? Do you hear anything that concerns you? And people just want to be reassured that they're going to be fine. And what I usually tell them, and I always ask, I check in on mental health because it's important, but also proper eating habits. Are you getting exercise? Yes, we're in the middle of a crazy pandemic, but you can get outside. You don't have to be with anyone. You can walk. You can talk to your friends. You can do whatever you need to do to uplift yourself. You can pray. My goodness. When the pandemic first started, I was waking up in the middle of the night, checking the phone, looking at numbers every day, and it was making me crazy. So I had to, honestly, I prayed and I asked God, help me stop worrying about this stuff, because I don't have time. I got to help people. I don't have time to worry about every little detail, but I do have the ability, thankfully, to be able to do something about it. Did that answer the question?
It answered the question, and I just want to ask you one more question. You know,
Yes, ma'am.
there's not a vaccine that's been approved for the children 5 and under. Do you have any recommendations? You know, we're starting to unmask, but what do you think about those 5 and under? Whether you think they should still be masked or what? Because I know that's a concern of some parents.
Yes. So that is a very good question. And here's what I would say to that. Children who are under 5, it's so hard to mask them and to have them do that on a consistent basis. So what I would suggest in that instance is still trying to limit unnecessary interactions with outside people. Now, of course, the people in your household tend to be less of an issue, but of course, depending on their activity, that may be more of a challenge. So to answer that question, what I would say is do your best with the masking, but you may have to just continue to isolate them until you feel comfortable having them around people. And I know, again, for my daughter, our circle is very small, especially in the pandemic. And so what we do is if we want to get together, we're testing ourselves. We have the ability to do that now, thankfully, with the rapid test, which that's not the best form, but that's what we have at our disposal. If it's positive, those folks need to stay away. They need to isolate. So for the younger people, if isolation is probably the best method if they're not able to properly mask.
Well, thank you so much for all those answers to all of our questions.
Sure. It's been my pleasure.
We certainly do appreciate you, Dr. Donaldson, being with us and really dispelling some myths that we've all been thinking about, as well as hearing our young people talk about as well. So thank you for being with us and sharing with us about COVID-19 and our youth. So much appreciated, and we'll certainly continue to be in touch.
You are very welcome, and I have enjoyed it. I hope you guys have a great evening, and thank you for inviting me.
Absolutely.
Thank you.
Thank
You
you
too.
so much.
Thank you.
Bye-bye.
So to everyone, thank you for joining with us today in our conversation about COVID-19 and our youth. We were certainly enlightened and reminded about and dispelled some myths about COVID-19, the vaccine, and why some of our young people have decided not to. If you have any questions, please continue to put those in the chat. You can follow us on Facebook as well as on our YouTube channel. And that is Facebook. It is Brighton Rock FAC19. And also on our YouTube channel, you can go to B Rock FAC19. We will see you in the near future with several more sessions to come. Thank you for joining in the fight with Brighton Rock.